Hi everyone, this is Dr. Ernesto from Attaboy Cowboy, and in today's video we're here recording at my Uncle Oscar's house, and we're going to give you some tips on how you can improve non-fluent aphasia or Broca's aphasia. Now, about a month ago, my Uncle Oscar had a stroke, a very mild stroke, but it did affect his speech mildly. And I'll give you an example. Uncle Oscar, can you sing the Beatles song we were practicing earlier today?
If I fell in love with you, could you promise to be true forever? Please do.
Okay, that's perfect. So as you can see, his voice is very clear. Now, he would be considered a very mild case of Broca's aphasia, and that's why Uncle Oscar was willing to volunteer to help me make this video so we could help out other people that have Broca's aphasia. Now, like anything else, there's a whole spectrum. Some people are so bad you can't understand anything they're saying. The thing is, when they're saying it, they think it's coming out perfect, so they don't realize it. They can't understand why other people aren't understanding what they're saying, and that can be very frustrating for patients, which oftentimes leads to social isolationism. They get upset, they don't want to hang out with people, they don't want to do activities with family, etc. So in our case, what we're going to try is what's called MIT, like the university in Boston, Melodic Intonation Therapy, instead of Massachusetts Institute of Technology. And in Melodic Intonation Therapy, basically what you're trying to do is the left hemisphere of your brain is where you have what's called the Broca's and the Wernicke's area in the brain. And those are responsible for speech production. But in the right side of your brain, or the right hemisphere, that's responsible for interpreting sounds, melodies, and music. So what we do is by intertwining music with speech, we lend a hand basically to left hemisphere, and what we do is we promote something called neuroplasticity, or the growth of more neural connections, so that way it can help pick up some of the slack for the damage there in the left side. And oftentimes you'll see the speech smooth out over time when people practice this. Now, remember, when you have a stroke, it causes a lot of inflammation in your brain, okay? It's kind of like twisting your knee, you get a bunch of swelling in there and it hurts and you don't want to move a lot. Where your brain, you get a lot of swelling also. So in the beginning, right after a stroke, it's hard to speak, it might be hard to move depending on the type of stroke you have. And in Oscar's case, his speech has been steadily improving. But we're going to go over how you do this melodic intonation therapy so that he can help smooth out his speech even further. So we're going to do a quick exercise, and basically what you want to do is you want to start off slow. Start off with an easy song with a slow rhythm, something you're familiar with, and you can practice it at home on your own. You practice humming the song and tapping. You want to tap to the melody of the song, okay? As you progress, then you'll start mouthing the words. So I'll start off here with Uncle Oscar and we'll practice. So, row, row, row your boat gently down the stream.
Roll, roll, roll around, tell me down the street.
Merrily, 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 life is but a dream.
Merrily, 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 life is just a dream.
Perfect example. So you can see there that we can improve a little bit on that speech. Now, it's just like exercise. Anytime you lift weights, your guns are going to get bigger. If you have an issue with a neurological problem, specifically right after a stroke, you have a window of about 6 months where you can get the most improvement. So luckily with your brain, you can work out at different times of the day, but you want to keep it short. So I would say you want to practice this melodic therapy maybe like 3 to 5 minutes, but maybe 5-10 times a day. The reason being is after you've had a stroke, your brain needs to recover. If your muscles are tired, then you don't work out, right? If you twist your ankle, you don't go play basketball because your ankle's going to get worse. Well, your brain is similar. It needs to rest. So after a stroke, your brain is processing sensory information: visual, gustatory, olfactory, auditory, tactile. Okay, so you want to try to limit light exposure, limit sound, and you want to kind of chill out and sleep as much as you can. Normally, when you have an injury, you want to rest. You want to, rest your knee or your back if it's hurt. But in a brain injury, you want to rest as much as you need. Whenever you feel tired, you want to lay down. Sometimes stroke patients will tell me, well, hey, doc, I'm feeling really lazy, so I'm going to force myself to go out and walk and do this. Don't do that. Not when you have a stroke. You want to let your brain rest so you can clear out that swelling. It'll increase your sensory processing and it'll help with the repair process. Whenever you sleep is when you're producing growth hormone, and that's when you go through more of the the shedding and the healing inside of your brain. For optimal recovery, you got to get as much sleep as you can. So you do a little bit of melodic therapy, maybe you go for a walk, you do whatever you want to do, and then don't push it. It's not like other things where you want to push yourself and work as hard as you can. You want to do small increments throughout the day. That's going to help you recover much faster and you're going to get much better results. So in Oscar's example, he's going to practice this melodic therapy several times a day. And I know Oscar really likes Beatles songs. You want to say that Beatles song again, Oscar?
Oh, if I fell in love with you, could you tell me could be true forever? Or I do do dee do da ba 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 bum.
Perfect. Okay, so what you can do at home is you can look up your favorite song and then play it, and maybe while it's playing in the room, your brain's gonna process it, and then you're gonna intertwine it with motor movements. You're gonna tap to the music, so you're following the melody. Once you get the tapping down, that's gonna be step one. You're gonna start tapping and humming. That's gonna take two parts of your brains. And then as you advance, you're gonna do tapping and singing to the song. Once you advance and you get that down, you're going to be able to start another song. And that's gonna be as if you were bench pressing 300 pounds. It's gonna be a lot of work for your brain. It's gonna be excellent for recovering your speech and helping it get back to normal again. So thank you for listening. And from Los Angeles, California, this is Dr. Ernesto and Uncle Oscar. Goodbye.
Goodbye.
Now, if you had a stroke or any other type of brain injury, before you start taking MCT oil or fish oil, make sure you consult with your doctor first, because depending on the types of medications you're taking, there could be an interaction with the fish oil or the MCT oil with the drugs you're taking. That is always the case. Every time you take a supplement or anything, you always want to talk to your healthcare professional first. Make sure there isn't an interaction so you don't increase your risk for more problems.